got Deleo with their Cristal Pro cryolipolysis. Now that is fat freezing, but body layering is the thing here we're going to be talking about this evening.
Cristal body layering is a holistic 3-step program that's going to enable you to combine 3 different technologies to target the fat, so refine the body, target the muscle to tone it up, and then target the skin, where you're going to give that finishing touch by firming the skin and the texture of it. So the aim is to tackle all different layers of the body to give the best results basically for the silhouette in its complete. This is our fat freezing device, which is the most advanced fat freezing device on the market today, where we put safety and effective and efficiency at our top priority. We do manufacture in France, and we are very happy to be here to be able to share the experience and the knowledge with the patients and the doctors that are here.
And we've got some people trying treatments out this evening.
Yeah, we have. We've got quite a lot actually, back-to-back patients that are wanting to basically to unfreeze their fears. I think that's the basic phrase of the night. To get over the bad buzz, to get over the scare of fat freezing and what they've heard recently, and to be able to experience that there are devices on the market that will be safe, efficient, and give the best results.
So sitting next to me is the lovely Dr. Galyna Selezneva, and Galyna is based at the Dr. Rita Rakers clinic. We're going to be talking about body contouring, fat freezing, specifically the Deleo Cristal Pro device, which I know you're a really big fan of.
Giant fan. Hi, hello everyone. Hi. Giant fan is not even a word. I'm obsessed with the device, and I've had 1 or 2 devices in my life, and this is incredible. Yes.
Okay, so talk to us a little bit about the technology behind the device, because I think, fat freezing kind of isn't perhaps as simple as it seems. So talk to us about how it works.
I think you're very kind, Georgia, because it is so confusing. Not only fat freezing, but any device, any Google search that you're looking for body contouring, or you're looking for rejuvenation or non-invasive, oh my God, the information is being bombarded. So actually, fat freezing, or cryolipolysis as it's called, is just a term. And then under this term, like think about an umbrella body. And then under this term, there is a number of different devices, and then the names of devices are also different. But actually, the technology behind is the same. We are freezing the fat. During the treatment, and you can see the live treatment there, during the treatment, as in the half an hour or an hour treatment, the fat cells crystallize. And once they're crystallized, your body no longer perceives it as a fat cell. So it becomes the enemy of the state. So your body will have inbuilt ability to then metabolize the fat out of your body. You basically, I'm sorry to say, you pee it out. So it goes through your liver, your kidneys, via lymphatic system, and you evacuate it. Sorry, am I being too descriptive?
No,
but that's
not
the
at all.
reality.
We have to be real about these things.
And then under this whole cryolipolysis, there are different brand names. And there's 1 or 2 of the more known. I don't think I'm going to name them, but you know exactly what I mean. And they, over the years, and it's been a decade that they've been on the market, and I've used it for about a decade, but about 4 or 5 years ago, I have discovered, after a lot of research, because we always research our technology, we have discovered Deleo, and it's phenomenal. So I've been working with Cristal, which is the name of the device, so it's Cristal Body Layering by Deleo, for 4 years. And last year we has launched Cristal Pro, and let me tell you, it is the safest device within the cryolipolysis. Why? Because the way the temperature is controlled is completely different to any other fat freezing devices. I have an ultrasound scanner on the machine to allow me to assess, not only to grab you as they advise on your training, or you just come and grab a person's fat, why not? No. I actually can visualize the subcutaneous fat layer, so my treatment actually becomes guided by technology, by ultrasound. Of course, my eye as well, and I do a bit of grabbing. Come on, we all, I need to get close and personal with my patient. But the idea is that ultrasound scanner allows me to visualize the depths of subcutaneous fat cells. What am I treating? Am I okay to go there? Is it okay for me to go there? Now, the inbuilt safety protocol as well in the machine is phenomenal, and done so much clinical research and studies to back their claims that I can tell you, yes, it works and yes, it's safe. So I'm not here to defend the company, but I've been working, my patients are so happy. In 4 years, almost 5 years now, in 5 years, 4 years was Cristal and 1 year was Cristal Pro. I have very happy patients. And I've never had a late phone call at night, as I did with previous device. I'm not going to name it.
This is what I think it's important that we maybe just even briefly just mention. Why is that ultrasound scanner so important, and why is it so important that when people want these treatments, they visit a reputable practitioner who uses a device as safe as the Deleo Cristal Pro? What can go wrong?
Oh God, many things, and I have seen them all, because over the past 10 years, people bring me those things that go wrong, they bring it to me. So actually 60% of what I do and what I have done over the years is I specialize in corrections of treatments that have gone wrong elsewhere. So I actually see and sometimes report it back to the companies when I see something. But first of all, Deleo as a company is an incredibly reputable French producer. It's not the only device they do. They have other devices. They have a muscle toning device, they have lasers. They are coming up with new technology, so they're a very reputable producer. So that's first point. Second, to answer your question, you want to have a good machine. Then, in the same way as you drive a car, you want to have a good driver for that machine, right? Because if I'm going to drive Ferrari, oh my God, God help us all, because I'm going to be in the nearest tree. But if I'm driving my Deleo, I know what I'm doing. So when it comes, and here you're going to see many devices, you're going to see many technology. It's not only the technology that matters, it's who performs the technology. So you want to have, it's your body, it's your face, you're going to be left with the outcome of the treatment. So you do want to invest, as I always say, kind of aim for the highest, and then see if you're feeling comfortable with the doctor. And I'm going to say it importantly again and again and again, a doctor, cryolipolysis or any technology still should be doctor-led. It's not only the doctor who performs the treatment, but doctor should be doing the consultation, should see you, should assess you medically whether you are fit. There are some amazing therapists that can then perform the treatment on you, but it's a doctor-led treatment and it should be respected. Secondly, you want to, I personally don't do before and after photos. I don't believe that somebody's best result is what's going to be replicated in you, but the consultation part is incredibly important. And during this, don't be scared of bringing all your questions, of writing down the questions, asking. Even if you're running out of time, that's fine. Come again. Consultation is incredibly important because you have to understand that not only is the person should be good at what they do, but they should also have the same belief, same philosophy, or same look or outlook. You know, they should have the same perception about your outer thigh as you do, because you want to maintain the body proportions. Sometimes some of my patients come in and they grab their love handles and they're like, I can grab it, I want to go. And then I have to convince them that there's nothing wrong with being able to grab your hip, because it's a hip. It should come out. So don't be, actually you want your doctor to start, well, maybe not arguing back with you, but at least not agreeing with everything you're saying, because you might see your body from a perspective of that one grabbable love handle. I see it as the whole. I should see it as the whole of you. And sometimes even the fact that you can grab a fat, it doesn't mean that it should be gone.
Yeah.
Because I have to respect the natural curve, the natural line, the rest of you, if I may say. Sorry, am I like off? I'm off topic.
No,
right.
I
told you I talk a lot.
It's important to emphasize, I think, that you want to go to a practitioner who empathizes with you, who understands your concerns,
100%,
but who won't just kind of treat anything because that's what you ask them to treat. Because you're going to a professional, right? You need someone's experience to come into that consultation.
I think the experience, the aesthetics, and I'm not talking about how they look, but also that they should see a body or face, same applies to the face, in the same eye as you see it. So if you, in your belief, the lips are the predominant part of your face and you want them kind of to be treated, they should also see the rest of you, not only the lips. Same here, it's not only about your grabbable fat. I mean, we all have that, it's normal, but if they stand up and it's all in proportion, then yes. Earlier today I have talked my patient out her inner thigh, because she was a younger patient, and I rarely treat younger patients, but she was a younger patient and she was convinced that a thigh gap is actually a thigh gap, and she was adamant that she doesn't want the natural curve of the upper hip inner thigh. Yeah, it's called inner thigh. Sorry, I'm Ukrainian, so every now and then my English fails me. But it's the inner, there should be a nice curve, and she did not have excess volume there, so I didn't want to treat it. But it's not only about refusing the treatment, it's also explaining how the aesthetics of the body works. So actually I was successful, but we decided to kind of, go for a nice hydrofacial. So, she was in the clinic anyway.
Okay, and so just quickly, can we talk about which areas of the body can be treated with Cristal Pro and what sort of results your patients get? Or maybe we can start, which is the area that is perhaps most common that you find people coming wanting to treat, and then what are those results like when they've been through a course of treatment with Cristal Pro?
So first of all, I love the question, which area can be built? So it can be treated in an experienced hand, pretty much any area. There are areas that are considered on protocol, and there are areas that are considered off protocol, and I always very open with my patients. I have literally treated pretty much every part of the body if there is good treatable fat for me to treat. In the same way, I have refused to treat many areas in the body which I didn't think needed treatment. But we can probably treat the most requested area when it comes to women and men, which is the abdomen. And if you are like me, I'm 42, I am just a little bit away from perimenopause, right? But I have underactive thyroid, so no matter what I do, weight loss, so I've treated, there you go, underactive thyroid, yeah, great thing, might as oh yeah. So there you go, you see, it's very common. So no matter if I even use normal weight loss, it just doesn't go from my abdomen. So I've had a couple of treatments on my abdomen with fat freezing, and it's abdomen and love handles still remain very popular areas. And I'm sure you've heard the term hormonal belt. Oh my God. So as we grow older, it is lower abdomen, it's like a belt. And it's not what you eat, it's our bodies, ladies. They, the hormones are to blame, let's put it this way. So it's not what we eat, it's not that extra glass of wine in the evening. Your body's metabolism is not as prominent or evident, or whatever is the English word to use. It's just not as speedy. It needs a bit of help. So we have different machines to address that. And Deleo remains one of my favorite devices to use because it's very effective. Some patients will need a one-off treatment. Some patients will need 2 treatments. And sometimes they're a bit slower responders and they might need 3rd treatment. But those are usually I never treat before 6 weeks. So they're usually 8-10 weeks apart. So we never over-treat. We always wait for your body to respond, and then we treat again if needed.
We're going to have to wrap up. Galyna can talk for England and Ukraine.
Yes, it's true. It's true, right?
But thank you so much. If anyone's interested, Deleo is here with us.
And also, if I can say, consultation in the clinic are complimentary. So we don't charge for consultations. Whoever wants to talk about their body's face, please, Dr. Rita Reika's clinic, I'm there, and I will talk to Yeah, I do talk a lot. So, but find me at Deleo as well.
Thank you so much, lovely. Thanks, everyone.